What do you do when you wake up in the morning with toothache?
Or just going out to a fancy restaurant for a special occasion with friends and during dinner you bite down normally and find half your molar has disintegrated, leaving you with a big hole in your tooth with a jagged edge which your tongue will constantly attack with a will of its own, and it quickly becomes lacerated and painful. How about after having a dinner your upper tooth suddenly becomes tender, and over the next few hours your gum begins to throb and soon your face swells up and you end up looking like you have a bad case of the mumps. Toothache or any sort of pain in the mouth is one of the most distressing and uncomfortable things anyone can go through, and especially when you do not expect it and not able to contact your dentist, as it often happens after hours. What do you do? Because toothache can stop you dead in your tracks and cause so much disruption and makes you a different person altogether, as you can think of nothing else except how to stop this pain. The cause could be a simple filling fracture, in which the quickest way to plug it as an interim measure is to use sugar-free gum to chew and use it to plug the hole until you are able to contact your own dentist in the morning. If there is pain, you may need to take some analgesic which will deaden the symptoms, especially before bed, so you can get some sleep. If a crown has become dislodged and the underlying tooth is not sensitive, then it may be best to leave it out so that you do not risk swallowing it, especially when asleep. But chances are it is a front tooth, and you obviously do not want to be seen with a gaping hole in your smile. You could use some sugar-free gum and place this inside the crown and then see if this will seep back onto the tooth, and avoid using it until you can see your dentist in the morning. A slide tender gun will respond to warm hot salt water mouth soaks, where you keep the warm water on the side of the infection as long as possible and repeat it as often as possible until you can see your dentist in the morning. But on the other hand, if there is a large swelling either under the lower jaw or there is a large swelling and your eye is closing, you would be best to call an emergency dentist or go down to the local accident and emergency department at the nearest hospital for antibiotics to control the infection. Obviously the best cure is prevention, but when things happen, as they most commonly do when you least expect